Today we shift our focus to stress, a topic that is deeply relevant not only to the patients you will care for, but also to yourselves as future clinicians. Stress is more than feeling overwhelmed. It is a pattern of cognitive appraisal, physiological response, and behavioral reaction. It occurs when a person perceives an imbalance between the demands of a situation and their coping resources. For example, a woman in labor may feel intense stress not because labor is inherently negative, but because she perceives herself as lacking control or support. Likewise, a student facing examinations may interpret the same workload differently, depending on coping skills and emotional resilience. Stress manifests in diverse ways, and these symptoms may appear in patients, colleagues, and yourselves. Nervousness, a general feeling of unease or tension. Inertia, difficulty initiating tasks or engaging in activities. Insomnia, trouble falling or staying asleep despite exhaustion. Headaches, often tension-based. Dizziness or fainting, particularly under acute emotional strain. Nightmares, as the brain attempts to process emotional overload. Identifying these symptoms early can prevent escalation into more serious physical or psychological complications. Stress does not arise solely from emergencies or crises. Much of it is rooted in daily life. Common long-term sources include pressure from work, school, or society. Expectations placed on healthcare students and professionals can be particularly intense. Frustration from delays, lack of resources, or loss. In maternity settings, equipment shortages or miscommunication can heighten stress. Individual differences in nervous system reactivity. Some individuals are biologically more sensitive to stressors. Understanding these factors allows us to contextualize emotional responses rather than judging them. When a stressor is identifiable and controllable, people often use direct coping strategies, such as confrontation, facing the issue head-on, compromise, adjusting expectations or goals, withdrawal, stepping back when further effort is futile. For instance, confronting a workplace issue may resolve tension, whereas withdrawing from an argument during labor may prevent unnecessary escalation. When the stress source is unclear or too overwhelming, people may turn to defensive coping mechanisms. These include denial, repression, projection, identification, reaction formation, displacement, and sublimation. Not all of these are maladaptive. For example, sublimation, such as channeling anxiety into clinical preparation, can be protective. Others, like repression, may provide temporary relief but lead to unresolved emotional tension later. Chronic stress can contribute to a wide range of physical conditions. For skin, eczema, hives, acne. Respiratory, asthma, hyperventilation. Cardiovascular, hypertension, migraines, coronary heart disease. Endocrine, diabetes, adrenal dysfunction. Musculoskeletal, headaches, muscle cramps. Gastrointestinal, gastritis, colitis, ulcers, constipation, obesity. Genitourinary, menstrual disturbances, impotence, vaginismus. This list demonstrates why stress should never be dismissed as just emotional. Managing stress effectively requires intentional strategies such as progressive relaxation, meditation, hypnosis, or yoga to reduce physiological arousal. Exercise and stretching, improving circulation and reducing tension. Stress desensitization, gradually reducing sensitivity to stress triggers. Massage and psychotherapy, supporting both body and mind. Nutrition, laughter, play, and music are simple but powerful regulators of well-being. Patients and healthcare providers alike benefit from integrating these habits. Problem-focused coping is most useful when the stressor can be altered. These strategies include planning and active problem-solving, suppressing competing distractions, exercising restraint, and assertive confrontation. For instance, preparing a birth plan with a high-risk patient or scheduling tasks systematically during clinical placements are forms of problem-focused coping. When a stressor cannot be changed, such as bereavement or a diagnosis, emotion-focused coping becomes more appropriate. These strategies include positive reinterpretation, acceptance, denial or regression, escape avoidance, wishful thinking, controlling feelings. While not all of these are equally adaptive, they reflect the human attempt to maintain psychological balance. Humans cope better when they are not isolated. Stress reduction is enhanced through guidance and practical advice, emotional support, affirmation of worth, and tangible aid, such as financial assistance. For pregnant individuals, support from a partner or midwife can significantly reduce anxiety and improve outcomes. Some aspects of stress response are biological. Evolutionary mechanisms that prime survival, fight or flight, autonomic and endocrine system responses, impact on immune function, individual biological variability. This variability explains why two people exposed to identical stressors may respond entirely differently. Psychological dimensions also play a role. Cognitive appraisal of demands and consequences, personality traits such as optimism or resilience, coping style, self-efficacy and expectations of support. In clinical care, enhancing a patient's perceived control can significantly reduce stress. Environmental influences include the number, intensity, and duration of stressors, predictability and controllability, the availability of social support, and cultural interpretations of stress. For example, cultures that normalize labor pain may cultivate less fear than cultures that portray labor as traumatic. Finally, sustaining your own well-being as a practitioner is essential. Helpful habits include balancing work, rest, and personal time, exercising regularly, practicing meditation or reflection, setting realistic goals and pacing yourself, prioritizing tasks, building supportive relationships, using coping statements or affirmations. Your emotional health is not a luxury, it is a professional requirement. Understanding stress and coping helps you care more effectively for patients experiencing vulnerability, uncertainty, and fear. Equally important, it equips you with strategies to sustain your own well-being throughout your studies and professional life in midwifery.